A bunion is a common condition that is also referred to as hallux valgus. That's more of a scientific term, and it involves a bump that develops on the inside of the foot. So the best way to look at that is probably with a foot model. So if you imagine looking down on your foot, a bunion involves the big toe, and it involves a bump that occurs right on the edge of the foot at the base of the toe. And the condition is really caused by several things. Genetics is the most common cause. So if your mother or your grandmother or father had this condition, then there's a pretty good chance that you might be susceptible to developing it. The second thing that causes this also is types of shoe wear, which can make it worse if you already have it, but can also start to cause you to develop it. And we often look at really tight toe box shoes as being the cause, and then high heels. So fashion shoe wear is, as a general term, the biggest probably cause of shoe wear bunions. And what happens is that the narrow toe box of the shoe causes the big toe to tilt toward the little toes. When that happens, it stretches the ligament on the inside edge of the big toe, and when that occurs, then that starts to angle itself like this. And so that angling really is a deformity more than just a bone growth. It's actually causing the bone to come outward toward the inside of the shoe, and the toe to go toward the lesser toes or the smaller toes. And a bunion causes pain because of pressure usually, not as much because of the joint. So pressure in the shoe because of friction on that area is where bunion pain occurs. It can lead to arthritis if not treated and if symptoms become more significant over time, but in most cases it's primarily a pressure problem within shoes. Once it occurs, it restricts shoe wear and makes it hard to find the right shoes. You know you have it because of the things that we've talked about, pressure or a bump on the inside of the foot. Treatment of a bunion is usually started at home, and so we recommend some home remedies. First of all, you have to change the shoes that you wear. That's one of the biggest part of treatment of a bunion. And the best thing to do is to consider shoes that have a wider toe box to make space around that area where the bunion occurs. And there are athletic shoes are often a good way to start. So an athletic shoe that has a wide toe box. A croc or a soft type of a slip-on shoe can sometimes reduce pain in that area. And then sandals or flip-flops often are pretty effective in reducing the pain over a bunion. We usually recommend backing down on the use of fashion shoe wear if you don't want your bunion or your condition to become more significant over time. Other home remedies include anti-inflammatory gels or gels that can reduce pain or pain gels over the bump area that occurs. In addition, you can use toe spacers to help separate the big toe and the second toe. So in the case where you've got the bunion, if the toe has started to tilt significantly over towards the little toes, putting a spacer between those toes can help to relieve some of the pressure on the bump. In addition, there are some manufactured night splints that you can wear that will pull the toe back away from the little toes. Those can be effective in reducing temporary pain, but they don't usually correct the bunion. Corn pads or other types of pads that you'll find at your pharmacy or sometimes online can help to reduce some of the friction that occurs there as well. Ultimately, the only way to really treat a bunion long term, if it is painful and you can't solve it by shoe wear, is with surgery. And bunion surgery is one of the more common surgeries that's done on the foot and ankle. What we do with a bunion surgery, again looking at the model, is to make an incision on the side of that bunion or on the top of the foot, and then removal of the bone in that area is required, along with tightening up the ligaments on the inside of the ankle and releasing the ligaments on the inside of the toe, and then also releasing the ligaments on the outside of the toe. When we do that, we bring that toe from being tilted over to a straighter position, and usually we have to make a cut in the bone to help shift the bone back to a normal position. Bunion surgery can be painful during the first 2 to 4 days, and then it can also be a long recovery process. So if you have your bunion corrected, expect that you're going to be swollen for up to 3 months afterwards, and getting back into shoes will probably take at least that much time before you start to feel like the swelling has gone down. However, success rates are between 92 and 95% for good to excellent results, and if you ask patients whether they would do it again, 92% of the time they say yes. So in general, reconstruction of a bunion is an effective treatment.